This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're standing outside the emergency department here at Aurora Medical Center in Oshkosh. It's hard to believe that anything can go wrong on a beautiful day like this, but our friends inside, well, they're pretty much busy every day of the year. Today we're going to be speaking with Jennifer Franz. She's a registered nurse and also the stroke coordinator here at Aurora. She wants us to know about the signs and symptoms of having a stroke and why it's so important to seek immediate attention if you think you're having a stroke. Well, thanks for joining us today. We're in one of your emergency rooms right now. So many life-saving devices behind us, and a lot of them helping out with people that are dealing with strokes. And we were just talking before we started this interview, there are two different types of strokes. Can you kind of tell us about those?
Sure. The two different types of strokes are they can be ischemic stroke. So that's where a blood clot is, or a plaque is cutting off the circulation to the blood in the brain in one of the vessels. So that can be caused like people that have hypertension or high cholesterol. From that, people can have a TIA, which is a mini stroke from that. The symptoms don't last very long. They last less than 24 hours. But if they have a long-term ischemic stroke, those symptoms will last 24 hours and can be life-threatening. The hemorrhagic stroke is more of the vessel ruptures in the brain. So it's due to high pressure in there.
Okay. Would a patient realize which stroke they're having? And I guess that's not important for a person. What would be some of the signs that somebody that they would feel or notice that would say, hey, I better get some help?
Sure. The symptoms of stroke vary on the individual, but it's more of weakness of the face, the arm, usually on one side, or the leg, including that. They can have some slurred speech, difficulty understanding, or being able to talk to people. They can also have headaches, which is more of the hemorrhagic. They have a sudden onset of a headache, worst they've ever had in their life, and they're really not attributed to anything that they've done. They can also have some difficulty swallowing, and really more weakness and fatigue.
It's interesting, we were talking about some of the issues that people go through when they're trying to decide whether to seek out help for stroke. And you probably see more people that think they're having a stroke than they're actually having a stroke. But it's important, if you think you're having any of those symptoms, to seek help immediately, isn't it?
Correct. Yeah, most of our interventions that we can give to patients are time sensitive. So it's based on the patient and their physician's guidance. But there are a lot, like up to 18 hours is a lot of the interventions. So getting to the hospital timely is very important if you're having any of the symptoms to be evaluated.
Yeah, if you guess wrong that you're having a stroke, you can walk out. But if you think you're having a stroke and you actually are, what are some of the things people would be dealing with if they wait too long to react to a stroke?
Correct. The lifelong disability from it. So if you don't, you might have arm weakness or limited strength in that. It is the leading cause of disability in the United States and one of the four leading causes of morbidity and mortality that people have. So it's really getting it to there timely to see if they can help you out is important.
If a person thinks they're having a stroke, should they get in their car and start driving, or do you need to call 911?
If you think you're having a stroke, I definitely would call 911 so the paramedics can get there and help you, because you hate to have something life-threatening happen on the way into the hospital. Absolutely.
Yeah. What happens when a patient comes in to the emergency department with stroke symptoms?
We definitely take you back to the emergency room quickly. There's a lot of things that kind of happen all at once because it is a very time-sensitive thing and can have some drastic effects. So they'll bring you back to a room, ask you a whole bunch of questions about your health history and medications that you're on, and then you'll see the emergency room physician and then be taken to CAT scan most of the time immediately, as well as some lab draws to kind of help us decide on the treatment plan. So it's kind of a pretty fast-paced in the beginning.
Right, and a lot of times it ends up not being a stroke and a person can walk out shortly after that. But if they are having a stroke, what happens if a patient is admitted?
Admitted to the hospital, it's kind of a little less chaos there per se. They do go to usually our stroke unit, which is our intensive care unit, which is stroke certified unit for the Joint Commission. So we send all our patients mostly there. They kind of get worked up. They can have further CTs, imaging, such as an MRI, lab results, kind of to pinpoint exactly what's happening.
I know, Aurora, you guys are very proud. You have a certification when it comes to stroke awareness.
Correct. We are actually a primary stroke center since 2008 through the Joint Commission, which kind of says that we can take care of the stroke patients in the community.
Yeah, what are some of the things that you do?
We do a lot of, we're starting to do some community education. We meet all our measures for Joint Commission. We kind of evaluate all our stroke patients to make sure that we're providing the best care to them.
All right, Jen. Well, we appreciate you taking some time with us today.
All right. Thank you so much.
Again, it is so important that if you think you're having a stroke or you have any signs of a stroke, that you call 911 immediately. If you have any other questions regarding stroke, talk to your primary care provider or give us a call here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.